Wisdom teeth are the final teeth to arrive in our mouths, and they usually present themselves between in age 18, age 22 approximately. It's very common for them not to have quite enough space to make it all the way through into the mouth. And they often end up either being stuck completely under the gum or partway through the gum. And that's what we refer to as being impacted. If they come partway through, the little flap of gum that sits over the top of the tooth is commonly infected, and that's by far the commonest reason that we remove wisdom teeth. It leads to often repeated low-grade infections and occasionally more serious ones. We also remove wisdom teeth because of tooth decay in the wisdom tooth. Sometimes cysts form around about the tooth. And we also occasionally remove wisdom teeth because they can make cleaning of the tooth in front difficult. And this can sometimes lead to decay in the tooth in front, and therefore removing the wisdom tooth can sometimes prevent that. There are some other rarer reasons why we take out wisdom teeth, but they're very uncommon indeed. Wisdom tooth removal isn't considered major surgery usually. It is, however, sometimes quite difficult surgery, and there are a number of complications that go with having your wisdom teeth removed. Most people are a bit sore and they're quite swollen after having the wisdom teeth out, and that usually presents itself most obviously the day after it's done. The swelling usually disappears after a few days. However, there are two main other specific warnings that go with having your wisdom teeth removed, and those are both to do with nerves. Both are nerves of feeling. One runs underneath the wisdom tooth and gives feeling to the lower lip on that side. The other runs beside the wisdom tooth and gives feeling to the tongue on that side. Injury to those nerves is very rare, but if it happens, the consequence can be some change in feeling in either your lower lip or the side of your tongue, or potentially both. It's very rare for it to happen, but if it does, the consequences, as I said, can be an alteration in feeling. If it happens, it's usually a temporary thing, which gets better on its own, although that can take quite some time, and we're often talking in terms of months rather than days and weeks. Everyone who has a wisdom tooth removed should, before that, have an X-ray taken of the wisdom tooth. And that normally gives us some signs that might lead us to warn some people more than others that these complications are more likely to happen to them. And if that's the case, there are some further investigations that we sometimes do. Particularly now, we often do an investigation called a cone beam CT, which gives us a very good picture of how the nerve in question relates to the tooth. Removing wisdom teeth can sometimes be as simple as having an ordinary dental extraction. However, because wisdom teeth are often embedded in the jaw either fully or partially, we sometimes do need to consider a surgical procedure to remove wisdom teeth. That normally involves initially an incision in the gum over the wisdom tooth to fully uncover it so we can inspect it and see what needs to be done. And we will often then remove a small amount of bone from around about the tooth and occasionally cut the tooth into several pieces to allow us to remove it more easily because it is jammed where it sits. We use a drill very similar to a drill that a dentist might use to do a filling for this. Once it's finished, we wash out the tooth socket and we repair the gum using usually dissolving stitches. We can tackle this kind of surgery either under a local or a general anaesthetic, depending on how the patient feels about it and how difficult each individual tooth might be. The length of time it takes to remove a wisdom tooth is very variable indeed, and it can range from anything from a few minutes, even up to an hour for some of the more difficult teeth, although that would be unusual. It's very common after someone has particularly the lower wisdom teeth removed to be quite sore and quite swollen afterwards. The swelling usually is at its most noticeable the day after, getting better each day. And usually by the time a week's gone past, most people are pretty much back to normal. If it's been a difficult tooth and it's been a surgical extraction, many people might be expecting to have a week off work afterwards, although it can be a very variable thing between different people.